and I've met quite a few of you in the past. So, but I'll turn it off during the presentation so I'm not distracting. But I definitely am excited to be here today and present the dental vision hearing plan. And just want to talk a little bit about Manhattan Life before we get into the benefits and let you know a little bit about them. They're a privately held company. They've been around since 1850, doing life and health insurance. And Manhattan Life, obviously, we started in Manhattan, New York, hence the Statue of Liberty. But our main offices are in Houston, Texas. And that's where they've got about 500 employees down there. And that's where all the administrative work, claims, I mean, everything is done in Houston. So they're a great organization. They're fun to work with, and they're responsive to our needs. And their technology is first class. Definitely, they're a leader in that part. But one of the things about being a privately held company that I like, in the past I've worked for stock held companies, and the stock held companies make decisions based on shareholder value, which that doesn't always align with the agent or the policyholder. On a privately held company, they make decisions based on the policyholder and the agent, and they aren't beholden to stockholders to make that decision. So that's one of the things that I really like about them, and along with their financial stability. And this dental and vision product is something that they've had for years, and it has really, we get a lot of traction with it. So I think you'll find it competitive, and I think you'll like what you see there. I was wanting, I was wanting to change screens, and Sadie had told me how to do it, and I felt so confident about it. I think I've got it figured out there.
There we go. We see it.
Thank you. Anyway, I had a moment of angst, but we made it through. This is your agent dashboard. I wanted to take a minute to show you this before we get into the benefits. When you have a Manhattan writing number, this is exactly what you'd be signing into. On this, you access the e-application, go straight to the e-app. You can write multiple policies with one application. The signature for the client is the mother's maiden name. That's one of our big things there. The client doesn't have to click on anything or respond to anything. You enter the mother's maiden name, and that's all they have to do. That qualifies for the signature. But also on this dashboard, your first page you come to, you can track your monthly sales, your commissions, your in-force business. You can download your agent policy list, all your policy holders that you have, check on claims, billing information, all of this is right at your fingertips. Then you have agent tools, which is a media gallery, training. You can do self-training here, order supplies. Anyway, they make it all really easy with a one-click situation. And then on downloads, you can hit product downloads. It'll download a map of the United States, and you just pick what state are you selling in, where does the client live, and like we're just going to say Missouri to keep it easy. It'll bring up every product that Manhattan has to sell in that state. So today we're going to look at the Dental Vision Hearing Select, which they also have. There's an older product called Dental Vision Hearing, and we just had some of the older agents that didn't want to let that go, so we left it on there. But the Dental Vision Hearing Select is what we're going to talk about, and that is really the product that you want because it has the enhanced benefits to it, and the premiums are pretty close to the same. So you would just click on the brochure, and if you deal with Spanish speakers, all of our stuff's in Spanish, so that's a big deal. But we're going to stick with the English version. So I speak Okie English, so that's what you're going to get. So we want to make sure I can read what I'm talking about here. So we got the Dental Vision Hearing Select, and underwritten by Manhattan. It's pretty much available everywhere. And I'll show you a map at the end to show you where we have the product. Individual ages 18 to 99, what that's telling me is that we don't do child-only dental plans. They have to have one adult on the plan. So if they have an 18-year-old kid, that qualifies for the adult. But anyway, so all ages, you can get a 0 deductible. I like that, less confusing. Guaranteed renewable for life, guaranteed issue. Here's a big point, no waiting period for dental services. So dental starts day one. Orthodontia, there's a 12-month waiting period before it kicks in. But that's a big selling point, is we'll cover adults as well as kids. So if a 99-year-old bought the policy and they wanted to get braces, they would have coverage there after a year. Anyway, we'll cover, I'll dive into that more as we go on here. And then we just added a $5,000 policy max last year. And the $3,000 right now is probably our most popular option, but some people like to get as much as they can get. And so that's an option. And choose your own dentist. You do not have to use the network. We deal with a lot of agents in rural communities, and the networks just don't work that good out there. And so the beauty of this policy is it'll work whether they're in or out of network, pays really good either way. And what I want to hit here is on dental, that is the base plan. You have to have the dental to get either the vision or the hearing rider on it. And the example here just showing you can buy dental and vision, you can buy dental by itself, dental and hearing, or you can do all three together. This is the actual brochure that you guys have to use. And so that's why I'm wanting to use it, so you see exactly what you would be looking at. So dental exams cover 2 a year. If you're in network, pays 100%. If you're out of network, pays 80% of the usual customary reasonable charges. On your basic services, it's like a filling or that 360-degree x-ray, panoramic x-ray they take of your teeth. Those are called basic services. Pay 65% the first year, day one. And then start with the second year, it pays 80%. They're on for the life of the policy. And that brings up a good point in my mind. I just had pop up, renewals are paid for the life of the policy. So major services pays 20% day one, 50% second year after. That could be implants or crowns that you have. And as you can see on the out of network, it just mimics it over there, the usual customary. So they have this right here, other medically necessary services. This is just saying if you have something done that's not up here, that's not listed here, and the doctor says it's medically necessary, we'll cover it just like a major service that you have. Orthodontia, I told you I'd come back to that, and here we are. You see right off the bat, it has to be in network for the orthodontia to pay. Out of network is not covered. 12-month waiting period starting the second year, pays 50% up to $1,500 per person. So if they had $3,000 worth of expense, we would reimburse 50% up to the $1,500. I had a good question the other day. They said, does it cover Invisalign? Yes, that is a covered expense. That's a brace, orthodontia. So anyway, covers adults. I can't stress that enough. I think that really sets us apart. And then I want to cover vision and hearing. These are both riders, as we talked about. There is no network. So wherever they go, they can claim benefits on here. They just turn in for reimbursement. And so the way it works, you can read it, it says 60% the first year, 70% the second year, and 80% after that for these services. And then on eyeglass frames, there is a 6-month waiting period. before it'll pay on the frames. And then it'll pay $200 a year for contact lenses or the eyeglass frames. No network, go wherever they want. And then on the hearing services, I think this is really important. Pays for brand new hearing aids, necessary repairs. Had a lady, she accidentally washed her hearing aids in the washing machine and had to take them in, get them repaired, pays from that. If they have to get batteries, they'll pay for that, whatever supplies that they need to keep those going. And then the way it pays, it's $750 per ear per year. So $1,500 worth of benefit that you have here. And to give you a live example of this, because I fell in this category, is I have hearing aids. I bought some about 7-8 years ago. I paid over $4,000 for them. I went to Costco 3 months ago and I bought their best pair of Philips hearing aids, $1,630 all in, taxes, fees, everything. And so Sam's has gotten into it, Costco, CVS, Walgreens, they've all gotten into the game and the prices have come down dramatically. So I just make that point because if you're talking to somebody, they immediately think hearing aids, $5,000. That's not the case. It's not it anymore. And but anyway, there's a 12-month waiting period on the hearing, and then after 12 months, it starts paying it. And like I said, up to $1,500. The cost on it, you'll see here in a minute, it's like $3 a month for a 70-year-old, very inexpensive. They use it once in their lifetime, it's paid for itself. Let's look at the network, the Carrington network right here. That's who the network is on the dental. And remember, whether they can use it or not use it, that's up to them. We're going to pay either way. And the Carrington is very large. They have 100,000 dentists nationwide. We pay for their top tier. So if you want to go look at what our discounts are, you would want to make sure you use our URL there to see what our discounts are, because they're better than what they normally give out. I'll let you guys look at this later. This just gives you an example of how the network works, how the policy pays. But I want to keep under my time here, so let's go to the rates. So we've got 1,000, 1,500, 3,000, or 5,000 benefit. Most of the time, like I said, I see $3,000 benefit, sometimes $5,000, just whatever fits their pocketbook. That's what you're doing, fitting their needs with their pocketbook there. So you've got an individual that you can insure, individual spouse, individual children, and family rate. The family rate includes up to 3 children. So what if you have a 4th child? You don't have to determine who's going to be covered and who's not. You would just add this premium here, the 3 to 17 rate, and that would cover the 4th child. Now, if you're doing an e-application, it does all of this for you. You don't have to figure any rates. I like the e-application for a couple reasons. One, the rates are correct. You know that they're figured correctly. They can read your writing, and you get paid quicker, and the policy gets issued quicker. So there's a whole lot of good reasons to do the e-app, but you do not have to. We still take paper apps. We don't charge extra for it. If paper's the way you want to go, we'll take it that way. You can fax your applications in or snail mail them in. Again, it's just whatever fits you there. So I think we covered this pretty well. I don't think we missed anything. I was trying to give you time to look at the rates, how they run. I can tell you, if rule of thumb, the difference between a $5,000 and a $3,000 benefit is 10%. So as I promised, here's a map of the United States. The colored states are the states that we have the product in. So you can see it's pretty inclusive of everywhere in the United States. So again, give you a minute to look at it and see the states that you operate in. I also want to make the point, we have the old dental vision hearing in these states, which I'm not showing, but it covers the map up pretty good when you add them in there. Virginia, Montana, Wisconsin, DC, and Maryland. The dental vision hearing product, the original one, is available in those states. And currently we're working to get the vision hearing select into those states, but you do have an option around there. Virginia is the one I get a question about a lot. And but anyway, so you do have product there. So I went pretty quick, and hopefully I answered your questions. But if I didn't, let's open up the floor and let you guys see what questions might be there.
Absolutely. So we don't have any right now, so we'll be here for just a minute or two more. Go ahead and throw your questions in the questionnaire box. Otherwise, we will kind of get out of here. But Kemp, while we're waiting for people to throw their questions in there if they have any, could you just, this is kind of a basic question, but a lot of times people get a lot out of this. Since you are the person that works with these products, you teach these products, what do you feel that if an agent is speaking with a client, what do you feel are some benefits on this specific plan that could really reach out and grab the client's attention?
Okay, well, the orthodontia benefit, that is a big one, covering adults as well as kids. And the second one would be the covering in or out of network. I deal with a lot of states that have rural areas, and that out-of-network benefit is really a good benefit. So I think that's important. And then the other one would be, no, I've lost my train of thought here. I saw your picture pop up and you just distracted me. No waiting periods on dental services. I apologize about that.
Yeah.
That's the other big one. You got day one coverage for dental on there, everything except the orthodontia. So that would be, those would be my big points. The $5,000 maximum that we added this year, that's been really popular. And anyway, that's it. I like having the option of having the vision or the hearing or all three. A lot of plans don't offer the hearing, and that's getting to be, more people are being aware of that. And kind of like we talked about the prices coming down, that's been important that way.
Yes, absolutely. Yeah, like you said, a lot of dental vision and hearing plans out there really don't have much of a hearing benefit at all. And that is one reason why we love this product so much, because it is something that there's not really too many solutions out there for the cost of those hearing aids. And obviously, you know, the market that we work with, the senior demographic, that's very much a need. So absolutely love that. Love how this plan is flexible. But it doesn't look like we have any more questions. So Kim, we will go ahead and get out of here. If you all have any more questions after the webinar, that's totally fine. Give us a call at 800-689-2800. And we are happy to get those answered. Let's see, if I have questions about other Manhattan Life products, is Kemp the one to contact? Absolutely. If you have questions about other Manhattan Life products, you can give us a call and we can connect you over to Kemp and his team. We can chit chat with you about those, but yeah, go ahead and give us a call, Wanda. Happy to help you out with that. But Kemp, do you have anything else to add before we get out of here?
Well, that would have been the thing I would have added. Thank you for the question. Feel free to reach out. Any individual health and life product, that's what I specialize in. And we do have a large portfolio of products. And I think as time goes on, we'll do some more training on other products. But I'd be glad to talk to anybody about them.
Awesome. Well, thank you so much. And we will go ahead and give you guys back your day. Thank you.
Yeah, have a great day. Thanks.